Why do people get deviated septums even in the absence of trauma? Hi, I'm board certified facial plastic surgeon, Dr. Delaney, and this is a really interesting topic. Most people think of getting a deviated septum from getting a nasal fracture or getting hit in the nose when you're young, but in my experience as a rhinoplasty surgeon, I see that the vast majority of people who come in with a deviated septum have had little or no history of trauma. And so this is something that's actually more to do with how human faces and our skulls have changed over time. If you go all the way back into time and you think about early humans, we're talking Neanderthals. Now, we aren't direct descendants from Neanderthals, but basically our early ancestors. They're out there foraging, eating. They're oftentimes eating really dense, very fibrous foods. And so as a result, they have really strong jaws. Strong jaws, more prominent faces, and then the strong jaws help support all those muscles of mastication, and then the midface helps form buttresses to provide strength to the chewing motion. And then we humans learned how to cultivate plants, right? Agriculture changed, and then humans, instead of going from foraging, now they're more sedentary. We've mastered cooking, so food that human beings are eating now are becoming softer and more processed. We're getting more and more nutrients, so our brain's getting bigger, so our forehead's getting bigger, but our jaws, our midface, are actually getting smaller because we don't need those big, strong muscles to chew food anymore because we're no longer chewing really fibrous plants. We're not chewing really hard nuts. We're eating softer, more processed foods, right? So as a result, our jaws are getting smaller, and then our midface is also getting smaller. So overall, the lower 2/3 of the face is getting smaller, and the upper head is getting bigger. So how does that relate to deviated septum? So I haven't forgotten yet. So when your jaw is getting smaller and your midface is getting smaller, that'll result in a number of issues. So you'll get crowding of the teeth. So more and more people have to get braces, right? If you look at dental evidence from early humans, they usually have pretty good teeth because their jaws are bigger, so you don't have overcrowding. The airway, their breathing's better because they have wider midface, wider jaw to support the airway. And now with humans with smaller airways, we're having more and more issues with sleep apnea. Lastly, we're also getting more and more deviated septums because the septum grows here. And so basically what we're seeing is because the midface is smaller, the cartilage from the septum is still growing and it simply has nowhere to go. So if you think of the midface, the nasal cavity here as a room, and then the septum as a growing tree, if that septum continues to grow and it's too big for the room, it's got to bow to one side or the other. So that is why most people have deviated septums actually don't have a history of trauma. It's simply because of evolutionary changes that the midface now is too small for the septum of most people, and the septum bows out one way or another. And these patients then have trouble breathing, or they may have deviation of the nose externally that requires surgery to correct. So these evolutionary changes are something that have occurred over many generations. We're talking in the scheme of tens of thousands of years. I don't see it improving anytime soon. It may be something that continues to get worse over time, hard to say. Thankfully, we have modern medicine and great surgical techniques to help with the treatments, but it's just a really interesting thought, and I wanted to share my findings on human evolutionary changes resulting in what we're seeing today.